dead bug is the first exercise that we talk about, and we modify this by only using the lower body. We're not using the arms whilst we're doing this. And in fact, we're using our hands as sensors to place them on the core here. Now, your tummy is going to sit here. Your bum is sitting here, just under the sacrum. We've got the last two lumbar vertebrae, L4 and L5, and then the sacrum, which is the orange bone here, which we've got L5, S1 and L4, 5. And this is the region where most people have their lower back origin, or the lower back pain origin, the disc herniation, etc. It's in this section here. And as we're doing the dead bug, we essentially have the need to engage and stabilize our spine. People commonly make the mistake of doing a pelvic tuck here from doing Pilates and yoga in the past, and that flattens the lumbar spine and violates some of those principles of holding the spine neutral that we mentioned earlier. And then as they lift the legs up into the tabletop position, often the back can then arch because we're not holding things steady as we change the demands on the spine. And then as one leg goes out, we again have the propensity to arch again. All of this can give rise to aggravation and flare up in the lower back. And fundamentally, the dead bug is an exercise that you can do on the bed. If you can't get out of bed, you can do it on the floor if you are able to safely get down onto the floor and back up again. But it teaches you in the most safe way possible, especially with regression variations, so variations that make it easier. It teaches the safest way to start to learn to engage that core, because a lot of you guys won't be able to do it when you're standing, which is one of the reasons you keep having these flare-ups. So the main goal when you're doing this is learning to hold the spine steady, and then we're using the legs to apply a little bit of wobble, let's say, to the spine. And our task is to use our core musculature. That's the muscles of the core. So you've got your rectus abdominis on the front, which doesn't play that much of a role. You've got your transverse abdominis, you've got your obliques, internal and external, which are playing a much greater role, and you've got the lumbar spine muscles, and you've got the thoracolumbar fascia down here, which will be tense as well from the lats, etc. So hold everything nice and steady whilst those legs are moving. And to the degree you do this successfully, you won't get any pain.